Assalamu alaikum students. Today I will tell you about the organization of nervous system, which is your topic of anatomy of the brain. Here's the cranial nerve. First of all, I would like to tell you that there are the main components of central nervous system, which is the autonomic nervous system, which includes the parasympathetic nervous system and the sympathetic nervous system. Parasympathetic nervous system consists of the craniosacral outflow, and the sympathetic nervous system includes the thoraco-lumbar outflow. The components of peripheral nervous system, okay? The components of peripheral nervous system are the 12 pairs of cranial nerves. There are 12 pairs of cranial nerves. One is olfactory, which is concerned with the smell. Number second is optic, which is concerned with the vision. Number third is the oculomotor, which is related to the eye movement and pupil reflex. Number fourth is trochlear, which is concerned with the eye movement. Number five is trigeminal, which includes the face sensation and chewing movements. Okay, here you can see the parts where these nerves arises. Number six is abducent. Abducent controls the eye movement. Number seventh is the facial, which controls the face movement and taste. Number eight is vestibulocochlear, which includes the hearing and balance. Number ninth is glossopharyngeal, which includes the throat sensation, taste, and swallowing. Number 10th is vagus, which includes the movement, sensations, and abdominal organs. Number 11th is the spinal accessory, includes the neck movement. And number 12, the last one, is the hypoglossal, which includes the movement, sensation, and abdominal organs. Here is the 12 cranial nerves and their function. Here is the 12 cranial nerves, 1 to 12, and their names. You have to memorize these names and the parts from where they arises. Then you have the spinal cord nerve anatomy. The spinal cord, there are 31 pairs of spinal nerves. Number 1 to 8, 8 pairs of cervical nerve, 12 pairs of thoracic nerve, 5 pairs of lumbar nerves, and the 5 pairs of sacral coccygeal nerve. Cervical nerves C4 to C6, tetraplegia, quadriplegia. In the tetraplegia, if there is a problem in cervical nerves, there causes the tetraplegia, which includes the paralysis of arms and legs. If there is a problem in the thoracic region, first 12 nerves, 12 pair of nerves, they occurs the paraplegia, which includes when the spinal cord is damaged below the cervical spine. It may be injured in the thoracic spine or lumbar. If there is any abnormality in the lumbar sacral coccygeal nerves, the lumbar includes the 5 pairs and the sacral includes the another 5 pairs. The spinal cord ends at L2, but SCI injuries are possible below the end of the spinal cord. This area is called the cauda equina. The cauda equina is a branch of spinal nerves resembling a horse tail. Okay. There is anatomy of the spinal cord. Okay, there is a Dura Mater, caudal equina, lumbar, sacral, coccygeal, cervical nerves. Here the 8 cervical nerves, 8 pair of cervical nerves, 12 pair of thoracic, 5 pair of lumbar, 5 pair of sacral. This is the anatomy of posterior view of spinal cord. Then it includes the meninges. What are the meninges? What are the meninges? Meninges are the connective tissue with protective coverings of the brain and spinal cord. There are three layers from outside to inside. Number first is the dura from outside. I'm saying from outside. The outside layer is the dura mater. Here you can see the outside layer is the dura mater. Mater means mother, okay, which is a dense collagenous connective tissue. Number second is arachnoid matter, which is the fibroblast collagen and elastic fibers layer in contact with dura mater and a system of trabecula form arachnoid villi. Okay, and the third one is the pia mater, which includes the loose connective tissue with blood vessel. There is a physical barrier between the pia mater and the neuron. Okay, here is the meninges, which includes the scalp. The diagram includes the scalp. Scalp is the portion which is outside. Then here the skull bone. There is the dura mater, subdural space. What is the subdural space? Subdural space क्या होती है? Subdural space is the space between the dura and the arachnoid matter. The space between the dura mater and the arachnoid matter is the subdural space. Okay, and the space between the arachnoid and the pia mater is subarachnoid space. Okay, these two things you have to memorize it, that the space between the dura mater and the arachnoid matter is the subdural space, and the space between the arachnoid matter and the subarachnoid space is called the, and the pia mater is called the subarachnoid space. There is a choroid plexus. Choroid plexus occurs in the pia mater. Okay, choroid plexus comes in the pia mater. Choroid plexus consists of the loose connective tissue of the pia mater covered by simple low columnar epithelial ion transporting cells. Elaborate CSF fill the ventricle subarachnoid space and then do its function. Here is the anatomy of what? Here is the anatomy of the brain meninges. There is a diplotic vein. There is a dura mater superficial layer. What is the dura mater? Okay, dura mater is a opaque, thick, dense, tough, non-elastic fibrous membrane composed of densely packed fascicles of collagen fibers arranged in lamina. It incompletely divides the cranial cavity into compartments and accommodates the dural venous sinuses. ड्यूरा इज मेड अप ऑफ टू लेयर्स. ड्यूरा जो होती है वो दो लेयर्स से मिलकर बनती है. आउटर लेयर को हम इंडोस्टियल लेयर कहते हैं. इंडोस्टियल लेयर इज द आउटर लेयर एंड द इनर लेयर इज द meningeal layer. Okay, both are adherent to each other except at venous sinuses. The inner meningeal layer of the dura mater, जो inner meningeal layer होती है dura mater की, वो रिफ्लेक्टेड होती है 4 सेप्टा से. 4 सेप्टा 4 कंपार्टमेंट्स वो बनाती है, जिसमें आ जाता है फेलिक सेरिब्राई, जो कि नेक्स्ट. There is a phalanx cerebelli, tentorium cerebelli, and the diaphragma celli. Here is the cavernous sinuses. Venous sinuses of the dura mater. Okay, venous sinuses of dura mater. Okay. देन आई एम टेलिंग यू अबाउट द कम्युनिकेशंस, के कम्युनिकेशंस ब्रेन में किस तरह से होती हैं. ठीक है, जो ट्रांसवर्स साइनस होता है, ये आपको दिख रहा है ट्रांसवर्स साइनस के थ्रू. देयर इज अ ट्रांसवर्स साइनस के थ्रू होता है सुपीरियर पेट्रोसल साइनस की तरफ. ठीक है, सुपीरियर पेट्रोसल साइनस की तरफ ये जाता है. देन इंटरनल जुगुलर वेन, जो हमारे, जिसे हम शेरक भी कहते हैं, जो कि इंटरनल जुगुलर वेन होती है, वहाँ से ब्लड सप्लाई जाती है पेट्रोसल साइनस की तरफ. पेट्रोसल, ठीक है, ये रहा पेट्रोसल. इंफीरियर पेट्रोसल साइनस की तरफ जाएगी एंड देन वो प्लेक्सिस ऑफ वेन्स थ्रू इंटरनल कैरोटिड आर्टरी की तरफ से होकर वहां चली जाएगी कैवर्नस साइनसिस के थ्रू. ठीक है, देन फेशियल वेन से जाएगी सुपीरियर ऑप्थेल्मिक वेन की तरफ. ये सुपीरियर ऑप्थेल्मिक वेन है, यहाँ पर जाएगी फेशियल वेन के थ्रू एंड एंगुलर वेन एंड पेट्रिगॉइड वेनस प्लेक्सिस एंड डीप फेशियल वेन. यहाँ से सुपीरियर ऑप्थेल्मिक वेन की तरफ से जाकर वो जाएगी फेशियल वेन. ठीक है, यहाँ से आपको दिख रहा है कि जो यहाँ से जाएगी सुप्रा ऑर्बिटल वेन के थ्रू सुपीरियर ऑप्थेल्मिक वेन में, और सुपीरियर ऑप्थेल्मिक वेन के थ्रू जाएगी फेशियल वेन की तरफ. ठीक है, फिर फेशियल वेन की तरफ से यहाँ से वो ब्लड सप्लाई करेगी. There is a सुपीरियर सेजिटल साइनस है. यहाँ पर क्रोइड प्लेक्सिस है, जो कि आपके पास ड्यूरा मैटर के अंदर होता है. इंट्रावेंट्रिकुलर फोरामेन है, थर्ड वेंट्रिकल है. ठीक है, ये आपके पास आ जाती हैं. वेंट्रिकल्स की बात है, ये एरेकिनॉइड ग्रेनुलेशन है. यहाँ से सब एरेकिनॉइड स्पेस आती है, क्योंकि स्पेस बिटवीन द एरेकिनॉइड एंड द पिया मैटर इज कॉल्ड द सब एरेकिनॉइड स्पेस. देन ये मेनेंजियल ड्यूरा मैटर आ जाएगी. राइट लेटरल वेंट्रिकल्स आ जाएंगी.